I come to you tonight as a nurse. I am a nurse in site administrator at Roswell Park Cancer Institute in Buffalo, New York. I manage a... Please don't applaud. I want Dr. Hitz to hear all the speakers tonight, so just please hear my words. It's very important that he hears our message, but I thank you for your applause. Don't applaud anymore, please. Dr. Kitts, I'm a nurse. I'm a nurse first, but I'm a site administrator. And 2 years ago, that storm that they talked about in 2006 paralyzed both sides of the border and it was our opening week. We were trying to open our new facility, and we could not open because we were paralyzed by a storm that dropped us for 7 days without power, without mobility in our community, that went for miles. And yet 15 miles up the road, Niagara Falls, Ontario was in sunshine. They had power and we had nothing but darkness. Thank goodness it was October and we weren't freezing. But it was a terrible time as the community struggled and rallied together to get through it. That's just one occasion. We do it over and over and over again. Look at our parking lot out here tonight. In the gas crisis, we drive trucks. We drive SUVs because our community requires it. And I am considered essential medical personnel. When I cross the border, I cross the Peace Bridge, the customs border guys say to me, good luck, because they know my job to get to my hospital is going to be a tough one. But I get there and I get home to my community because people expect me to report for duty. Now, most recently, we received a independent auditor's report for patient satisfaction, and my clinic got a 98% patient satisfaction, unheard of in healthcare. And where did I learn that? As I accepted the praise from my CEO, I learned it at Douglas Memorial Hospital, where I started my career. I started it here as a mature nursing student in '92 when they were not offering full-time jobs at Niagara Falls. After I'd worked 16 weeks for free in consolidation, they did not hire us because of bed closures. But Douglas Memorial hired me, and I was mentored in my nursing knowledge, and my career took me across the river, but my heart and my family are here in my community where I return every day. The excellence that I learned in collaboration with the nurses and physicians and healthcare professionals that I learned at the Douglas Memorial, I exported that to Roswell Park. And now another community benefits from the expertise that I learned here. I was dismayed this summer as a consumer of healthcare to walk into the Douglas Memorial Hospital to see a physician whose office location was designated by paper arrows on a wall through the constant care bed unit that is now occupied by Meals on Wheels. I think Meals on Wheels is a very important community service, but to have the Meals on Wheels office located in the area of the hospital that used to be constant care beds, monitored telemetry beds, I was surprised, I was disappointed, and I was shocked, because as a manager of resources and to build my strategic plan for the growth of my clinic, that screamed of a misappropriation of resources. I'm looking at, where are those monitored beds? Where are they? And as I found my way to the physician's office, took care of my business and left, I wandered over to the area where I formerly worked. And I said to the nurses, is so-and-so here? And they said, not right now, she's off duty. And I wanted to touch base with my peers, so in preparation for this meeting tonight, I called them. I said, how's it going? Because I'm in an active recruitment phase right now at my facility, and I need really good, strong nurses, and I'm worried that my community hospital is in jeopardy of losing some very good nurses. And so I asked them, what's new? And they told me the name of their nursing unit now is called the Lighthouse. Well, we locals know the Point Avenue Lighthouse is historic. It's a beam that brings people in safe from the storm, and the nurses at Douglas Memorial Hospital have called their nursing unit the Lighthouse. It's an incorporation of the historic Point Avenue Lighthouse and the way they see their commitment to their community, a safe place in a storm. I was so proud of them. They continue to nurse with expertise in political fallout, in cutbacks, and all manner of things, and yet they're there on the front line working dedicated nurses. I was so proud to be one of them and to have been mentored in my career by them. And so as I'm a nurse educator for Niagara College, I said, what is it that could help you guys? What can I do for you? Because I am also a nurse educator. Dr. Colorado also asked his staff, would they be willing to learn the skills to do basic ECG and telemetry monitoring, and they said yes. Give us more to do, as Dr. Teal says, not less. We're trained, we're willing workforce. We want to participate. So I stand before my community tonight as a nurse educator and offer my services for free to teach the nursing staff the basic skills it takes for them to monitor beds. Now, in any budget crunch, anything provided for free should raise some eyebrows, but I mean it sincerely. I have all the textbooks, all the knowledge, all the skill, all the ability to turn that willing workforce into something that will support the doctors in their practice as they care for us. I need the doctors to stay in Fort Erie. I don't want them to export their skills to another community. I need them to be here, and I want strong nurses here to support them in their practice. This week in the paper, the Canadian Press picked up a University of Ottawa co-authored report that says where you live may determine your survival in an emergency. As I crossed the border daily, I looked at a young Canada Border Service agent and I said to her, how's it going for you? Your role has changed from a revenue collection agency into an extension of a police force now. They carry guns at the border on the Canadian side. That's something new in the last few years. And she's wearing a bulletproof vest as we're having this conversation, and I pray for her safety. When I look at the uniformed people in the building tonight, I pray for our police officers. I pray for anybody who has a driver's license in this town that could get into a motor vehicle accident, because as they have to delay their treatment from another community down here to pick us up and then take us somewhere else to treat us, we are in serious jeopardy, as Dr. Colorado explained. I teach my critical care students that minutes equals muscle. Minute in delay of cardiac care treatment, and doctor, you are an anesthesiologist, I'm sure you agree with this point. Minutes is of the essence. The more minutes of delay, the more cardiac muscle dies, the more we're in jeopardy. And I'm sorry, but I don't want my community to be in jeopardy at any time. So please, please make your voices heard. We are a community that also votes, Dr. Kitts. We vote. And we are a very fundamentally core value, proud community, and we are not isolationists. There is a plaque on the wall of Niagara Falls Hospital that thanks the community of Fort Erie and its service groups for their fundraising efforts in the purchase of the CAT scanner. And we knew we needed that CAT scanner in Niagara Falls because we benefited from its presence there. We're not asking for a CAT scan in Fort Erie. We're not asking for advanced care. We're asking to be willing partners in medium-level care. We can do that. We can do that as trained professionals, and we want to be part of that solution to healthcare delivery in Ontario. And Fort Erie is, while designation we call ourselves rural at times, do not confuse that with ignorant. This is a knowledgeable town, educated. Many famous people come out of this town. In summary, Dr. Kitts, I would ask that you urge the province to dissolve the Niagara Health System as it stands today. Their inability to assess the situation, assess the needs, to develop professional, collaborative, collegial relationships within the medical community itself tells me that they are not in a position to lead any medical group or restructuring plan. I also ask that the province seriously consider Dr. Teal's very strategic business plan. Quite impressive from a medical person to be so business-minded. She's a very impressive lady. And also I ask that when we dissolve the Niagara Health System, that the next candidate for the leadership of the health system be a master's in hospital administration candidate at the helm to understand the real impact of restructuring health care. It's very important to all of us. Thank you for your time.